What's up, everyone? This is Dr. Webb here. Today I wanted to talk about the typical lifestyle of a surgeon. What we do on a daily basis. To give a kind of disclaimer, my kind of work schedule is a little bit different from those who, when they finish training. I'm in my 4th year of orthopedic surgery residency training. So my kind of schedule is a little bit different from someone who's been out of residency for a number of years. But on average, I would say the number of hours that we work a week, if you add them up over a 4-week period, for instance, some people may work more than this, some people may work less than this, but on average, I would say between 70 and 80 hours per week. On trauma surgery, which I'm currently on right now, that number can get up to about 100 hours per week. The ACGME, which is a governing policy group of people who kind of make policies and different guidelines for us as residents, they made a limit that you're only supposed to work 80 hours per week, so we stick to that 80 hours. But I would say on average between 60 to 80 hours per week. Some weeks are less than that, some weeks are more. A typical day just depends on which rotation, which service you are on. In orthopedic surgery, we spend 2 months in different parts of the body. So we do 2 months of spine surgery, 2 months of foot and ankle, 2 months of trauma surgery, 2 months of sports medicine, 2 months of hand surgery, shoulder and elbow, the entire body except the brain and the belly. So, and depending on which rotation you're on, dictates how busy you will be. So hand surgeons are not as busy as trauma surgeons. So your hours on trauma surgery are going to be busier. Your hours on hand surgery are going to be less busy. Okay, so I got that out of the way. But a typical day usually starts around 4:30, 5 o'clock for me. I usually get up in the morning and I usually figure out how many patients do I need to see that day. If I'm on trauma surgery, there are a lot of patients that need to be seen. If I'm on sports medicine, where a lot of our patients go home the same day of surgery, there may not be that many patients for me to see. I may have to see 6 to 8 patients that morning. So if surgery starts at 6:30 or 7 a.m., I need to go see those patients before 6:30. So that means I would normally get up and get started and be at the hospital by 5:30, be done seeing my patients by 6:15 to be ready for surgery at 6:30. The day can be variable from each day. There's no day that's the same. So the reason why I like it always keeps you on your toes. Some days you may be busy operating from 6 in the morning to 6 or 7 o'clock at night. Other days you may only have 2 surgeries and be done by 12 o'clock. So during the day, we quickly grab something to eat. There's really not a lot of time where you sit down and have like an hour lunch break. I don't even know what a lunch break is. I see people sitting in the cafeteria when I'm kind of running by to go into my next case or going to see other patients, but usually you grab something to eat really quickly and you eat. And if you're a med student or if you are a surgery resident, you kind of know that same feeling that you eat when you can. During the day, there may be consults. You may get called by the ER to come see a patient with a broken leg or a broken arm, with a hip fracture. But usually the interns and the 2nd-year residents, they usually go see those patients and then they come talk to the chiefs or the upper levels, and then we'll come up with a plan whether we're going to operate on them or treat them without surgery and then go from there. So clinic is usually throughout the day as well. Sometimes, some days you're in clinic for half a day, sometimes you're in clinic for the full day. Clinic just means when you go to the doctor's office and you see the doctor in the office. And we see patients as residents in the clinic, and we change their dressings, remove their staples, we give them medications, we check their x-rays, patients that we did surgery on as well as new patients. And then you have your surgery day. So each day is different. It's a mixture of lots of different things that go on throughout the day. We see patients in the hospital when we get consults from the medicine team, and we see those patients for maybe a broken arm that was missed, or a patient fell in the hospital, or the medicine doctors want us to see a patient for a septic joint, which means there's an infection in the joint. We have to wash it out in surgery. So during the day, there's lots of different things going on, whether we're in clinic, we're in the OR, we're getting consults from the ER. I see patients in the ER, and first thing in the morning, I see patients who are already in the hospital who are kind of my patients who I kind of follow throughout their hospital stay. After the day, which I say on average maybe ends around 6 or 7 p.m., I get home and I still have to study. A lot of people think that once medical school ends is when your learning, your time that you need to study kind of ends. But that's not true. You still have to come home and study. Even if you work 20, 40, 60, 80 hours a week, you still have to come home and study. And then I usually try to work out maybe 3 to 4 times per week, and which is pretty tough, but on average I would say 2 to 3 times per week. And then I study for about two hours each evening. I prepare for cases the next day, and then I go to sleep around maybe 11 o'clock, and I do it all over again. So that's just a quick glimpse of what it is to have a day-to-day life as a surgery resident, as a surgeon. And like I said, if you're done with your training, this may be a little bit different. Work-life balance is important. It's hard to find that. You just have to find balance between juggling your work schedule with your family, your friends, and your your studying. But it is possible. There's a lot of people who have families. There are a lot of women in orthopedics who have children throughout residency training as well as after. But it just depends on how many children you want to have, how big a family you want to have, and what sacrifices are you willing to make to reach that goal. But it is definitely possible. We need more women in orthopedics. So if you're a woman out there and you're considering orthopedics, I'll say go for it. If you guys have any more questions, email me at overcometheoddsbook@gmail.com or contact me on my website, AntonioWebbMD.com. See you next time.